Well, now to give us a perspective on the progress of efforts to stem the spread of HIV/AIDS in Africa is Pauline Muchina, Senior Partnership Advisor, UNAIDS. Welcome to In Focus.
Thank you.
Now, in the World AIDS Report, we see a bit of good news relating to Africa, that between 2001 and 2009, we've seen a decrease in infection rates in Africa by about 25%. What do you attribute this to?
I think it's joint efforts of governments, civil society organizations, religious organizations, families and individuals. We have seen a dramatic change in the way people perceive HIV, the knowledge, at the level of knowledge of how HIV is spread and how it can be protected. And a lot of young people especially are using more protection and are reducing the number of partners. A lot of governments are putting funding into programs on the local level, on treatment. People who are living with HIV who need treatment are getting treatment from their own governments, but also significantly the reduction of stigma towards people living with HIV.
Yeah, and actually talking about treatment, we also noticed that there is a reduction in the infection rates of children, that's mother-to-child infection.
Definitely.
Is that also a sign of increased use of antiretrovirals and other forms of treatment?
Definitely, because when a mother is HIV positive, she can actually give birth to a negative, HIV negative baby by receiving treatment. And now that they are accessing treatment earlier, they are able actually to do that faster. And a lot of African countries are also providing that kind of treatment to the mothers. In all of it, about 80% countries such as Botswana, Namibia, have been able to provide almost 80% of prevention of mother-to-child transmission.
And that really gives hope to, you know, saving the future generations.
Definitely.
Now let's talk a little bit about also the deaths from HIV/AIDS. In some countries, it was like the biggest or the greatest number of burials every weekend was from HIV-related deaths.
Exactly.
What's happened on that side?
There's a lot of improvement because about 5.5 million people have been put on treatment. We still have 10 million people who need treatment, but there are so many efforts of civil society groups and governments, including governments like the United States, that are providing a lot of funding to support treatment. There are countries like South Africa, Botswana, Kenya that are actually putting their own money into treatment of their own people.
Yeah.
So, and people are seeking treatment earlier, so that it has reduced the rate of death among people living.
So people are living longer too.
Yes, they are.
Healthy lives.
Definitely.
But unfortunately, again, at the same time, Africa remains the region with a majority of infection rates, even with all these improvements.
Exactly.
Why is that the case?
There's a lot of factors. Poverty is one of them. Education level is another one. Gender-based violence and gender discrimination is another one. And also apathy, you know, just the feeling that it's not going to be me because it has to be someone else. And a lot of misinformation. And obviously a lot of work that needs to be done on the government level. And all educational programs need to be addressing this consistently, not only when it is World AIDS Day.
Very briefly, in fact, some people also fear that the use of antiretrovirals that are making people live longer and healthier, also making people downplay the effect and the impact of HIV on a person's body.
I think people don't understand that even the drugs that are available can have a negative impact on somebody's life. So obviously you have to remember to take it every day at a particular time, and you also don't know what impact it's going to have on you down the road. So it's very important to prevent HIV infection rather than waiting to be infected and then get treatment. So it's really important.
Let me give you a chance just to speak to anybody watching television on this show today. What would you tell them that they should do individually in order to help stem this infection rates?
There's a lot of things one can do. If you're already living with HIV, you have to live respectively, and also you have have also to live responsibly, and you have to access treatment if you have access to treatment. And also you have to know that it's not a death sentence. For those who are not infected, there are ways of preventing yourself, protecting yourself from HIV infection. You can use condoms, you can delay sexual debut, you can be faithful to your partner, and you can also reduce your risk factors in many ways by avoiding injecting drug use, by avoiding sex work and others. And reducing HIV infection is possible. We can actually have zero HIV infection, we can have zero discrimination, and we can have zero deaths related to HIV if we all work towards protecting people from getting infected.
In 15 seconds, what pitch can you make to the governments of Africa?
Love your people and put resources to protecting your people.
Thank you very much.
Thank you.
Pauline Muchina, Senior Partnership Advisor, UNAIDS. Thanks for coming.
Thank you very much.